Researchers are warning that the Trump administration pulling back from funding medical research is leaving Canadian children with cancer in limbo. Sick Kids Hospital in Toronto is pausing admitting new patients into 3 of its innovative clinical trials into incurable pediatric brain cancer, the only hospital doing research like this in the country. Their decision comes after the U.S. National Cancer Institute announced it's cutting off funding to an international group of childhood cancer researchers. So for more on the cuts and how they're being felt in this country, we're joined from Vancouver this morning by Cathy Brodeur-Robb, Executive Director of the C17 Network. That's a national group of pediatric cancer research programs. Welcome to your morning.
Welcome. Thank you.
So researchers we've heard from around the world have worked together under the Pediatric Brain Tumor Consortium since 1999. Why is global collaboration, first of all, so important in this kind of research?
Well, childhood cancer is rare, which is an amazing thing for families not to have to go through this. But when we do encounter childhood cancer, we have to collaborate around the world often to find the patients and to study the patient to know what the best treatments might be. This is why we've had such an interdependence with the U.S. in terms of the academic research that goes towards trying to cure children who have cancer.
Which studies in Canada are being affected by the cuts?
So these ones right now in the Pediatric Brain Tumor Consortium are really early phase trials. These are the trials that are geared towards children whose cancers are hard to treat, they're high risk, they're very poor outcomes. And that's why we need to collaborate. If we were to restrict research to one country, it could be taking us 15 years to try and complete a study. So the advantage of collaborating internationally is we can get these answers. We can get answers for the children that don't have appropriate treatments. We talk all the time about childhood cancer having an 85% cure rate, but the flip side of that is we have a third of those children who need access to innovative therapies. We need to find new treatments. And when we restrict that international capacity to collaborate, that's when we're seeing this incredible risk. Sick Kids was able to open these studies, and in one of the CAR T studies, which is really an innovative treatment, most of those kids didn't even come right from in Toronto. They came from across the country. We have access to incredible therapies through these kinds of programs that give hope to families. And I think this is the frustrating part from our side, is lacking access to that. What options do we actually have for patients in Canada?
Well, that is the question. Once these trials stop accepting new Canadian cancer patients, what options will these children have?
Well, one of the problems, and we don't like this in Canada, is families will look elsewhere. They'll look to try and travel to the U.S., but that means we don't have equity of access in this country. So we want to make sure that these trials can come to Canada. We can make pathways for families to get to these treatments, even if there's only one place, even if it's Toronto or Montreal. We can provide pathways for families to receive these incredibly innovative treatments. I mean, this is cutting-edge research in a space that there aren't a lot of different options. So we'll be heading down to the States this week to try and figure out whether there are ways. Right now, the decision to stop funding this group, they've indicated they wanted to go to a different group. The Children's Oncology Group holds another early phase trial group, but in August, they took all the Canadian institutions off the membership list of that group. So we're trying to find ways to open those pathways up again to get these studies into Canada.
Thank you, Cathy, for the work not only that you've done in the past, but that you're continuing to do, and under trying circumstances. We appreciate it. Cathy Brodeur-Robb, you've joined us very early from Vancouver this morning, and we appreciate it. Thank you.
Thanks.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.